Assalamu alaikum wa rahmatullahi wa barakatuh. I am Mohammed Zaidi, College of Medicine from Concord University. And today we are going to demonstrate the back examination. First of all, you should greet the patient. Mohammed Zaidi, وكان يفحص ظهرك. After that, you should ask the patient to stand up. At first, you should look at if there is any deformity. You should look from the side to see if there is any kyphosis or any lordosis. Then you should turn the patient and you see his back. And to see if there is any scoliosis or any back deformities or any trauma. After that, you should ask the patient to walk. You should ask the patient to walk on the back of his feet, then ask him to get back again. This is to determine if he has any L5 weakness. Then you should ask him to walk in his tip of his finger. And this also to demonstrate if he has any S1 weakness. After that, you should assess the movement of the spine. Assess the lumbar spine movement and the thoracic spine movement. So كده إلى آخر. You should ask him to flex and assess the level of flexion of the spine. Perfect. And you should ask him to extend. Normally it will be 10 to 20 degrees. And you should ask him for the lateral movement. And you should compare the both sides. Then you should assess the thoracic spine movement. By turning to the right and turning to the left. After assessing the movement, you should go for the special test for the back examination. You should ask first patient to lie on his back. And you should come from the right side of the patient. First, you should do the straight leg raise test. You should elevate the leg and note the face of the patient if there is any tenderness. Elevated for 70 degrees. At the same time, you should note if there is any tenderness. If there is no tenderness, you note it. You should induce it by dorsiflexion of the foot. There is no tenderness. At this time, you should differentiate between tibial nerve pain or femoral nerve or the pain due to hamstring muscle. So what you need to do is to expose the leg. You should expose the popliteal fossa and do the straight leg raise test again and flex it and press on the hamstring tendons, the lateral tendon and the medial tendon. And note for any tenderness. There is no tenderness. Between the two tendons of hamstring muscle, you should press to assist the tibial nerve. And there is no pain. And also you should assist for the femoral nerve entrapment. You should flex the knee and you should elevate في ألم أقولها. And if there is any pain, he should tell you and you should elevate. The patient has no pain. Let us leave. After doing these tests, the straight leg test and tibial nerve test and femoral nerve test, you should go for the neurological examination. You should start by sensory examination and motor examination for the both legs, and you should compare. At first, you should assess the level of L4, then L5, then S1. On the lateral side of the thighs, you should assess the sensation. The essence, good. Essence, hiss, and compare on both sides. Essence. Then at the level of L5, between big toe, essence. And with the lateral side of the foot for S1. After that, you should assess the power of the muscles. For assessing the L4, you should ask the patient to push. Go. And for L5, you should ask the patient to dorsiflex his toes, and you should resist. So we kill it. Go. And for S1, you should ask him for doing plantar flexion. Then you should move for the proprioception to assess the sensation of the patient by a tuning fork and asking the patient to close his eye. And on the opponent prominence, you should put it and ask the patient when to stop. Yes, yes. And here the opponent prominence, then you should stop. Plus. After assessing the vibration, you should assess the proprioception if there is any peripheral neuropathy. Sleek كده فوق كده تحت. الحين فين؟ غمض فين؟ فوق. And on the other side. And by finishing the neurological examination, you are completing your back examination, and finally you should cover the patient.